Okay, so everyone is now muted, and as you can appreciate with this number of people, it's not possible to conduct a meeting with good audio when everyone's mic is on. You can post comments, questions, and feedback via the chat facility. You'll also have the opportunity to ask any questions later, and we really encourage you to do this, so please ask away. Please do not post any links or images, or you will be removed from the meeting. And just a reminder that we are active on social media, so you can follow us at ARCC Ltd, ARCC Limited, and Croydon BME Forum on Twitter, Facebook, Instagram, YouTube, and TikTok. Okay, so Lorraine, who's the project coordinator at Croydon BME Forum, and myself, who I'm the project coordinator for the Cancer Awareness Programme at ARCC. We're working in partnership representing the BME Forum and ARCC on behalf of our own partners on a joint venture to bring awareness of cancer screenings to the forefront. I'm sure you've seen some reports or news relating to cancer affecting everybody worldwide. We're here to ensure you that the Black and South Asian communities of Croydon have the necessary information and support. So we've been speaking with people in the local community to gain an understanding of why cancer screenings amongst the Black and South Asian community are so low. I'd like to introduce this evening's speaker, Dr. Masood Moghul. We feel honoured to have Dr. Masood speak with us today, as Dr. Masood is a specialist registrar in urology at the Royal Marsden Hospital. As a urologist, Dr. Masood is currently doing full-time research based at the Royal Marsden Hospital and Institute of Cancer Research, working on the Man-Band project, focusing on early diagnosis in prostate cancer. Dr. Masood's specialist urology training has been in the North London rotation, and prior to this, he was a core surgical trainee in Oxford and an academic foundation trainee at Imperial College London. Alongside his medical career, he's a director of a nursing home and a co-founder of Dome Vitamins. We're lucky to have him give a talk this evening for the Cancer Awareness Programme Croydon on prostate cancer and why early screenings matter. So Dr. Masood, thank you very much for joining us this evening. Please could you tell us and help us understand more about prostate cancer and why early screenings matter? Thank you.
Thanks, Tom. Thanks for the intro. Yeah, that was a long bio. I didn't realize I'd send you all of that information. Maybe you got it from LinkedIn or something.
LinkedIn, yeah.
LinkedIn,
and Royal Marsden.
yeah, and the Royal Marsden website. Yeah, thanks. Thanks for everyone for joining. So yeah, as Tom was saying, I'm a doctor. I'm a surgeon with an interest in prostate and bladder cancer. My research is mainly around prostate cancer. I work at the Royal Marsden. We're predominantly based at the Royal Marsden in Chelsea, although I think we're going to have a much bigger presence at the Marsden site in Sutton over the coming years. They're just building a brand new building, so I think we were going to have more and more of a presence there from urology. So urology as a medical field is everything to do with your waterwork. So that includes kidneys, bladder, prostate, all of these things. And as I said, my sort of interest is in prostate cancer. I think, yeah, what was really good about Tom's introduction was sort of that particular focus of screening and screening in different communities and why things aren't the same, why there are health inequalities and what sort of what the reasons behind that are and what we can do to address that. So I'll talk a little bit about the project. I think a lot of it'll become apparent as I'm talking, why this is something that I think we're interested in. So I'll just this is a really brief talk, so it's not going to take too long. Tom, can you allow share screening just so I can share my screen?
Yeah, sure, absolutely. All right.
Thanks, Tom. Okay, cool. This is a short presentation about the Man project. So this is my research, and it's a project sort of linked in with the Royal Marsden Cancer Charity, the Institute of Cancer Research, RM Partners, and the Royal Marsden Hospital, which is where I work. So this a little bit of background on prostate cancer. Yeah, we're hearing a lot about prostate cancer. We're hearing a lot about cancer. Why is prostate cancer specifically important? It's important because it's the most common male cancer in this country and in many countries. It says here 40,000 men are diagnosed every year. It's now 50,000, and around 10,000 men die from prostate cancer every year. This is just in the UK. There's hundreds of thousands that are living with it. So it's incredibly common. And it gets more common as you get older. So it is a predominantly disease of older men, but that's not to say that younger men don't get it. It's more common in Black men, and we don't know why that is. We think it's something to do with genetics, but we don't know why that is, and the research into that area hasn't really been done. It's something that we are doing now, but unfortunately it's not been done historically. So if you are, so the chances of getting it for all men are 1 in 8. So that is around sort of 12.5%. But if you're Black, it's 1 in 4, so that's 25%. So really, really common. And if you are Black, or if you're from a lower socioeconomic group, your outcomes are worse. So what that means is that you get diagnosed later, usually, and in general, your outcomes in terms of how long these people live for are worse. Lots of reasons for that. Incredibly complex issue that doesn't just affect prostate cancer, but affects sort of healthcare in general. So this project began in Birmingham, not London, where a West Indian patient called Johnny, who was diagnosed with advanced prostate cancer. So he presented, like a lot of men do, in A&E, not able to pass urine, and following on from that, had the diagnosis done. So really late. And he saw Nick James, who's in the middle there. And Johnny was a very well-known jazz musician. So they started doing some jazz concerts, raised a lot of money. And that money was used to fund the van in Birmingham. But unfortunately, they couldn't get it started in Birmingham. And then Nick moved to the Royal Marsden, where he's a professor here. And then we started the project here. That's where I came in as well. And the idea is of developing ways of sort of getting men to present quicker and pick up these diseases earlier. So if you can pick up prostate cancer when it's inside the prostate, there's a good chance you can cure it, i.e. get rid of it completely, either surgically, radiotherapy, but get rid of it. If it spreads, you can never cure it. Once it's spread, you either die with it or from it. But you can't cure it once it's spread. So it's about catching it early, where we can do something about it. And as well as this, there are other sort of general health issues that are often undiagnosed, like diabetes and cardiovascular disease, so heart disease, blood pressure, these sorts of things that we've been looking at. So we set up this, which is the Man Van, which is a humongous van. This is the same one as the one that was in Birmingham, but we've sort of taken it over down in London now. And we started going to different sites, different communities, different sites, seeing men doing health checks, basically. Those health checks involve a few things, like I said, diabetic tests, blood pressure tests, and including prostate cancer checks as well. So this is, for those sorts of men, sort of mid-40s and upwards, who, can't get an appointment at the GP, haven't had health checks, making it easy for them, easy access, come in, have a check. and we give them their results, and anything that needs to be actioned, we take care of it. We write to their GPs, we write to other hospitals if they need more tests. Try and really streamline that pathway, and get them good access to healthcare. It's just a sort of time frame. We sort of launched December 2021. We worked on it for about a year before launch, and then we launched December last year. We've been seeing men since then. We've seen over 500 men so far, and yeah, we've had a lot of, these are some of the community organizations that we've engaged with. Men in Sheds in Sutton, the ARC, Croydon DME Forum, a couple of local churches down in Croydon, local councillors and things. So yeah, we've tried to engage as much as we can with different communities, and really particularly in terms of getting the right patients, the Black communities, through churches, to try and raise awareness, but also make sure that they can come and see us and actually have the checks done. Had some good publicity. Prince William came to see us on the van. He was really enthusiastic, so that was really good. This was earlier this year. So that's really helped sort of raise our profile and get our message out there. We've got some results as well. This is the last slide, but this data is from till the end of September, so just the beginning of October. So at that stage, we'd seen 444 men. 30% of them were Black, 11% Asian. So really, really high numbers of ethnic minorities, which I think we're really happy with. We found 10 prostate cancers, 1 bladder cancer, 14 diabetics as well. Lots of people with high blood pressure, lots of people that smoke, mental health issues, etc., etc. So yeah, it's been a really interesting year. We've learned a lot. We went to many different sites just to sort of build our own experience. Men in Sheds, GP practice in Croydon, in New Addington Parkway, the recycling centre on Factory Lane in Croydon. Went to a construction site again in Croydon. Went to Merton Housing Association. So we've done lots of different things. Some have worked well, some haven't worked quite as well. Got a lot of experience, and yeah, we've got some additional funding to continue this project for at least another 12 months, which has all been possible because of what we've been able to do so far, which has really proved the concept that this can work, this can find cancers, and that's the main aim. I think I'll stop talking. That's the end of my presentation. Tom, do you want to jump back in? Probably start taking some questions, and I can expand on various things.
That's it's fascinating. Sorry, I was just scribbling away some of the statistics there. It's quite shocking. I mean, I can't believe 50,000 men dying a year, which has gone up. 40,000
get it, and 10,000 die. Yeah.
50,000 get it. Okay, 10,000 die. No. 10,000 die. Yeah, and I believe because recently we've just filmed a promotional video for this program. We're looking at the stats as well, and again, quite shocking that I think it's still fairly high. Like, is it 1 in 13 South Asian men are at risk of prostate cancer?
Exactly. Yeah. So even in the sort of one of the least at risk groups, it's still quite high because it's such a common. I think messaging is so critical, and we have like Prostate Cancer UK and Movember are the two big sort of charities in the UK that do a lot of the messaging, and of course it is more common in Black men, but it's common in all men really. It's yeah, it's 1 in 13 for Asian men. Yeah, so it is common in all men, white men, Asian men. It's common for everyone. That sometimes gets lost, that people think it's only black men that get it.
Yeah, I suppose it's that it's not going to happen to me kind of mentality, possibly. So what would you advise then to anyone who, as you said, may suddenly realize, because is struggling to pass urine specific to prostate cancer, or could that also be something else?
Yeah, yeah, no, great question. So part of the problem is that there's nothing that will specifically make anyone think that this is because of prostate cancer. Struggling to pass urine is a really common problem. That's usually not because of cancer. It's just you're getting older, your prostate's getting bigger. So a lot of older men have problems passing urine. It's really common. Most of the time, nothing to do with cancer. And prostate cancer doesn't tend to cause symptoms until it gets quite aggressive and sort of quite advanced. So it doesn't tend to cause symptoms at the beginning. Obviously, if someone has symptoms, they should definitely get it checked out. If you have symptoms, yeah, I mean, without a shadow of a doubt, you should have a check for lots of things. Amongst them, diabetes and enlarged prostate cancer. These are all the sorts of things that you should have a check from your GP with if you have symptoms. But what we're trying to do is I mean, we do see a lot of men with symptoms as well. I mean, it's a tough problem because obviously, raising awareness is great, and the charities do that really well. But it's not that helpful if you can't get an appointment to see a GP.
Yeah, absolutely.
It's
And yeah, I was just going to say, and you hit the nail on the head there with if someone does have symptoms and they can't get an appointment, what would your advice be? Is it to continue trying, or
that's a really
I suppose there's
yeah, that's a really tough one. I would guess so. Yeah, it's just to keep trying, keep knocking, keep calling them, and just being like, look, I really, need to be seen. I would guess so. Yeah. Most of the time these problems are not severe enough to go to A&E with. Sometimes if it gets really bad, you might need to go. But most of the time they're not that severe. So you just got to keep trying and just but it's not easy.
And as you said as well, it only truly presents itself noticeably once it's progressed at a later stage, which is quite tricky. I mean, it's become one of the taglines we've had is sort of get educated, get screened, or in the new video coming out, we're having get seen, get screened. Obviously be noticed, but also, at the end of the day, it's going to be your GP who can help you out, right?
Yeah, no, yeah, and that is what they're there for. They're obviously under immense pressure with other things and COVID and stuff. So it's really hard for I'm not here to criticize GPs. It's really hard for them to see patients with symptoms, let alone someone who's going without symptoms, saying that I'm worried and I want a test, which is what a PSA test often is. But that's kind of where we come in. Obviously, when we're not we're just a small team at the moment, which is made of one nurse and one doctor. But so we're not able to solve everyone's prostate problems. But it's a start, and it's a new take on an old problem. It's a new take of kind of getting, rather than sending letters and advertising and kind of just telling people to go and just go. We're like, okay, you know what? We're here in your community. We're here in Sutton, in Croydon, in Merton, wherever, and we are here. You can come and see us. We're literally here for this thing. We're not a GP service, and we can't be. And if we tried to be, we'd just be, we'd just end up doing what GPs do and get sort of
Yeah.
snowed under with all of those things. So we have to try and stick to our kind of remit, but that remit does include a very basic health check and a check for prostate cancer. And we don't turn people away. Obviously, if someone comes in and complains of a problem that's not related to us, we try our best to point them in the right direction. And often a letter from us to the GP saying, we saw so and so for a PSA check, it was fine, but they had chronic pain in their leg. Could you take a look at this? Often that kind of prompt is really helpful, just to sort of for these patients to then follow up with. So we do try and help where we can.
Yeah, definitely. And as I've got family in the NHS as well, so yeah, I appreciate the strain that it's been under, especially since COVID as well. I was also there at Beulah Church doing free health checks, and we were doing like cancer questionnaires, local groups, and it was really encouraging being there for a couple of days and seeing the difference. And if anyone on here is considering checking out the Man Band next time it's in the area, please do, because as Dr. Masood said, it's not just a prostate check, it's a free health check, with backing by an amazing team. Royal Marsden, RM Partners, NHS, it's a very strong alliance. And I was going to ask as well, there are several types of checking for prostate, right? You mentioned the PSA test, which my brain's kind of it's been a mad week. So there is also the MRI scan, is that right? As an X-ray involved on the NHS website?
So there is an MRI scan. That's currently sorry.
Is it an X-ray?
No, there's no X-ray. It's just
Okay.
a MR scan. So it's no radiation. It uses magnets. So X-rays and CT scans use radiation. MRIs no radiation. So it's completely sort of risk-free. I think. Well, you get a small injection which has a very, very tiny risk of triggering a reaction, but really it's pretty risk-free. But the scans are really the next stage of diagnosis. So if you do the blood test and it's high or there are concerns, then they'll do the scan. So that's the next step. We don't do like MRIs in men just straight off the bat. If we did, we wouldn't have enough MRI scanners. The system would be flooded, and I'm not sure if it would be it definitely wouldn't be cost effective. MRIs cost a few £100 and a PSA test costs a few pounds. So that is very much a part of the next step of that pathway. So if you are seen and you have a blood test and the blood test is high, you'll be sent to hospital where you'll have a scan, you'll have an MRI scan, and then we'll take things forward from there.
Great. Yeah, it's just I remember from a recent panel my colleague Lorraine hosted as well. Within the Black community, there's a fear that it's going to be more of a physical examination.
We don't do that. We don't do that. I mean, the physical examination, which for those of you who are unsure what we're talking about, is a finger examination of the back passage to feel the prostate and feel whether it feels abnormal or not. Its use is debated heavily between clinicians that feel that it's still a really important part of the examination and it can give you a lot of information, versus a group of people that say it's a waste of time and it puts people off. What I will say is that we don't do it on the van. End of. We haven't done a single physical examination of the prostate on the van. The main reason for us is that it puts people off. And what we absolutely don't want to do is to stop people who are worried coming because they're worried that they're going to have an examination, an internal examination. So we don't do it. You might be asked to, you might be offered it when you get seen in a hospital, but you can say no. I mean, nobody can force you to have it, and you can just say no, and they'll just write patient declined. I mean, this is what I do. Patient declined physical examination. You'll still have the scan. That won't change. You don't need to have a physical exam to have a scan. You just have a scan anyway. It's if anyone is worried about that, we precisely for that reason, we're just trying to be as welcoming and as inviting as we can be. So for that reason, we don't do it.
Great, thanks for confirming that. So I've just seen Nadir has mentioned that they believe there should be a regular screening service at different venues across Croydon and elsewhere. For example, awareness program is part of the promotion. That's exactly why this program and Man exist. And as you said, there's been an extension with the funding. Is that correct for next year?
So I mean, there is no national screening program for prostate cancer, and the word screening in the medical community has a lot of baggage attached to it. So I've been very careful not to say that we are doing prostate cancer screening, because that is controversial. A group of people that think that it's not beneficial, a group of people think that it is beneficial. So that's controversial. I think it's going to get less controversial in the coming months and the next few years. I think it's the scientific evidence is beginning to suggest that it is beneficial. But that's the one side. This is not screening. A screening program would be where men, when they hit a certain age, you get a letter in the post that says, you have now turned 50. Please go and see your GP and do a PSA test. And then after that, in 2 years' time, you would get another letter through the post that said, it's been 2 years since your last PSA test. Please go back to your GP and have another PSA test. So that would be what a screening program would kind of look like. It can vary. It might be 2 years or 3 years, but rough, just as a general guide, that's probably what a screening program would look like. So we're not doing that, and we're not doing that right now, but we are doing awareness raising, and there's a lot of awareness in the communities already, but often, like I was saying, getting the tests and getting the checks can be really, really challenging for people. So that's why we're making our service available wherever we are in that sort of community. I think Tom's gone. If anyone else has any questions, feel free to jump in. I think Tom's disconnected. Or we can just wait for him to come back.
So, check. Got a question.
Yeah, sure. Yeah.
I had a test done about, I think about 2.5, 3 years, nearly 2.5.
I'm just gonna stop you there. So yeah, are you sure you want to be divulging like personal information? I mean, it's not a problem for me, but it's just for you.
Yeah. Okay. Let me just take the video off. Okay.
I mean, it's entirely up to you. I just to be aware, there are other people on the call, so you might, just if before you divulge any medical related information about yourself.
Okay. So just wanted to check with reference to, like, say, if you had a test done for enlarged prostate, is that what's the reputations or time period you can get the second one done?
Yeah, it's a good question. There's no firm evidence of when the next one should be. I think normally if someone's like in relation to prostate cancer, because an enlarged prostate is not usually a serious medical problem, unless you really can't pass urine at all and your bladder is completely full, and so apart from in extreme circumstances, an enlarged prostate is not an urgent problem. If you don't routinely need to get it checked, you can just get it checked when you have problems and you feel like your symptoms are becoming worse. For prostate cancer, it's a tough one. I think when someone's really high risk, they've got like family history, their fathers had prostate cancer, their brothers had prostate cancer, and it's really strong in their family. I think most people usually suggest having a PSA test maybe like once a year or something. If you're low risk and your PSA is kind of fairly normal, it might be every 2 to 3 years, but there's no firm evidence. I think there's no strict guidance or guidelines as to when you should have it done, how often.
Okay, so there's no correlation between enlarged prostate and prostate cancer.
Correlation? Is there any correlation between an enlarged prostate and prostate cancer? I think it's no, or at least very unlikely to be. You can have an enlarged prostate with cancer. You can have an enlarged prostate without cancer. You can have a normal prostate with cancer or without cancer. So no, there's no direct correlation. What's confusing is that the symptoms can be the same. The symptoms can be really, really similar. But most of the time, the symptoms are from an enlarged prostate, not from prostate cancer, because and as common as prostate cancer is, it's very common, and enlarged prostate is even more common.
Okay.
Right, fantastic. Thanks. Thank you for filling in there. Sorry, I just had an internet issue there. So yeah, before we move on, if there are any more questions as well, please feel free to either jump in or leave them in the chat there. Just going to launch a poll as well, which we've been doing. So it's just going to be 2 quick questions, multiple single choice. So the first one we've got is, I feel confident to recommend cancer screenings to friends and family. And either strongly agree, disagree, or strongly disagree. And the second one will be, cancer within my community is discussed, either openly, sometimes, a bit, but needs more awareness, rarely, or never. So just give you a few moments to fill that in. Thanks. So yeah, I can see about half of you have done that. Just give a few more moments. Okay. 2 more people. Okay, so we'll leave it there for the poll. Thank you very much. There's some interesting results. So as you can see, there's a strong majority there with strongly agree that they would recommend cancer screenings to a friend or family. And an interesting one with number 2, as you can see, 3 people going with a bit but needs more awareness, and openly and sometimes discussing the community as well, fairly strong. So no one going for rarely or never there, which is quite interesting. I'll just stop sharing that there. So yeah, again, if there's any final questions, please ask away. Otherwise, I'm just going to go ahead and tell you about some upcoming events which we're planning next month. which will be a nutrition and bowel cancer awareness with consultant nutritionist Kiran Inayat, who is now a cancer champion at Croydon BME Forum. Kiran's done some talks with us as well on nutrition and various cancers. So we've done breast cancer and we've done prostate cancer. The next one will be bowel. And we'll also be doing some awareness talks with survivors from bowel cancer, breast cancer, and prostate cancer. As well as that, as I mentioned, we've also got an upcoming promotional video for the project aimed at raising awareness about the program. So yeah, just keep your eyes peeled on our social media channels. Again, it's at ARCC LTD and at Croydon BME Forum. And also remember to subscribe to our mailing list for future events and follow RM Partners on Twitter at RM Partners NHS. And of course, enjoy the holiday season. So Dr. Masood, again, thank you so much for your time. Appreciate it's a busy period, and congratulations on the continued funding as well.
Yeah, no, thank you. No, so really excited to keep going and just see what we can find. Just before we go, sorry, Cherry Phillips, what are the main symptoms of enlargement of prostate versus prostate cancer? Very similar is the short answer. Very hard to differentiate between the two. Prostate cancer doesn't tend to cause symptoms until it's quite advanced, at which stage it's very similar. So like problems passing urine, waking up at night to pass urine, those sorts of things. Yeah, but very, very similar. Sorry, I think I've said that before, but I thought I'd just answer that quickly.
That's good. Yeah, it's always good to have it repeated as well. So thank you so much for a clear and articulated description of prostate cancer and why it's important to get checked.
Cool. All right. Thank you.
Thanks everyone.
Cheers.
Thank you. Stay warm. Bye.